How many of you guys have had a concussion? Odds are it's a lot of you. In athletics, it's extremely common with over 3 million concussions per year in the United States related to sports. In fact, the CDC estimates 10 to 15% of athletes will have a concussion in any given season. Unfortunately, many of these go unreported or undiagnosed, and many of these athletes will return to sports prematurely. And this mismanagement will lead to prolonged symptoms and sometimes long-term complications. Yesterday, I presented the case of a 16-year-old athlete who came to the office with complaints of headache, memory fogginess, depression, and she was having a hard time at school and keeping up with her schoolwork. 2 weeks prior to that, she had a bad header in a soccer game, and then this was followed later in the game by a pretty bad collision. She didn't black out or anything, so her coaches didn't really think anything of it. She's a tough girl. She's on the varsity soccer team, so she didn't want to disappoint her teammates. I showed the MRI of her brain, but it was completely normal, and that's the point that I want to make. Concussions are indeed a form of mild traumatic brain injury. We often think of a concussion as when someone passes out, but most of the time, this is actually not what happens. Concussions are caused by impact to the head or the body that causes the brain to have a change in its function. That impact can cause the brain to have a significant impact within the skull and alter its function. Not every head injury causes a concussion, and the symptoms can be very subtle. Also, the symptoms may not be immediate and can manifest days to weeks after the injury. Falls are the most common cause of concussion, but any contact sport such as boxing, football, soccer are common to have athletes that suffer concussions. Symptoms can include any of these, such as impaired memory, inability to focus, irritability, sadness or anxiety, nausea, vomiting, headaches, dizziness, or even changes in their sleep pattern. The impact from the concussion will shear neurons within the brain, and the brain won't function the same, and those misconnections have to heal. Recognition of an athlete that sustains a concussion is extremely important in management. In the immediate setting or right after the injury, please look for these things in a person that may have had a concussion: loss of consciousness, slurred speech, a dazed or confused appearance, a delayed response to answering questions, or forgetfulness, meaning that you ask them the question and they repeat it. Delayed symptoms that can happen days to weeks after include headaches, nausea, vomiting, trouble with sleep, feeling emotional or depressed, anxiety, changes in the taste or smell, trouble with concentrations, memories, and even keeping up with their schoolwork. Now, I showed our patient's MRI as being normal, and I think that's important because in a concussion, often there's nothing visible on the brain that we can see. Not that imaging is not important, because in severe head trauma, CT or MRI imaging is extremely important to rule out something severe, such as fracture or even bleeding in the brain. When symptoms occur in athletes, it is extremely important that they do not resume play that day. Why does that matter? Because returning to play too soon can put them at risk for another concussion. Back-to-back head injuries can have devastating consequences. Allowing the brain to heal from a concussion is extremely important before play is resumed, and that gradual return to play is best guided by a healthcare professional. When they return to play is individualized and really depends on their symptoms, and all symptoms should be resolved before they return to play. If a second concussion is sustained before the first concussion has time to heal, they are at risk for a potentially life-threatening complication called second impact syndrome. It's important to know that a young brain is still developing, and a head injury that isn't treated properly can potentially derail the development, can lead to long-term problems. One of the things that's extremely important is getting young athletes to recognize when they've had an injury and to come forward, because oftentimes they're embarrassed or don't want to disappoint their team. Disappointing their team is not worth disappointing themselves in the long run. Educate your children to recognize this in other athletes as well. For the first 24 to 48 hours, mental rest is paramount. You should limit activities like watching television, social media, and looking at their phone, including texting. Also includes homework, reading, driving, or social interactions. The brain needs rest. If there's ever a doubt that a person has had a concussion, the best thing is just to keep them out of play. You should seek immediate medical attention or call 911 if any of the following symptoms happen: worsening drowsiness or unconsciousness, seizures, increasing confusion or slurred speech, headaches that are continuing to get worse, difficulty recognizing people or places, any neurological symptoms like weakness or numbness, persistent vomiting, or behavioral changes. They should be assessed immediately to rule out something more severe. Proper management will allow athletes to return to sports faster, and improper management will lead to prolonged symptoms. Recovery from a concussion is a complex and dynamic process. Graduated return to sports after a concussion is recommended. Here is that progressive process as recommended by the American Academy of Pediatrics. You can pause this video right here to read through all of those steps. I mentioned prevention in the other video, so what can we do to help prevent concussions? Remember, these types of injuries can happen in any sport, and it's not just isolated to football and soccer. Avoiding contact with someone's head is paramount. That means educating the athletes on proper and safe play to help prevent injuries to other athletes, including themselves. Obviously, wearing the right protective gear for that sport is also important. And that protective gear should fit properly, be properly maintained, and be worn consistently and correctly. All rules of fair play and sportsmanship should be observed. If someone suffers a head injury, get them out of the game. It doesn't make them a wuss. Protecting your brain is the most important thing that we can do for ourselves. One game is not worth it. As we learn more and more about concussions and preventions, I'm excited to see what other technology may come into existence to help prevent concussions. This is a cue collar that some athletes wear in football. Slight pressure in the neck veins can cause decreased venous flow out of the brain and cause the brain to be slightly more engorged, which could potentially cause it to slosh around less and reduce the risk of concussion. More and more research has shown that repetitive brain trauma can potentially increase the risk of CTE, or chronic traumatic encephalopathy. It's a progressive and degenerative brain disease. It's not well understood, but can lead to cognitive impairment, mood disorders, behavioral changes, and movement disorders like Parkinsonian type symptoms. And even worse, there's not good treatment for this once it develops. We offered supportive care to our athlete in the case presented at the beginning of the video, and she went on to recover completely from her concussion. But if her head injury was recognized after the first impact of the game, she could potentially have recovered much quicker. In fact, almost 85% of concussions completely resolve without any long-term consequences. Another case of patient-focused and compassionate care. Remember to remind your athletes about head injury, prevention, and how to recognize them. And stay tuned next week, and I'll go through another case.